Hi, my name is Dr. Joseph Yazdi. I'm a board-certified neurosurgeon with over 20 years of experience. My goal with this video is to provide a complete reference guide for you about your surgical procedure. I will explain to you why and how your surgery is performed, review the risks and benefits of the surgery, and other treatment options to consider. We will also discuss your post-operative care. I hope that this video will be a recreation of your office visit and a good reference guide for you, your family, and your friends. The typical reason to come and see me is for back pain with radiation of pain, numbness, or weakness into one or both legs. Symptoms are usually worse the longer you're up and walking or if you're trying to bend and lift. By the time we're talking about surgery, it means that you've already tried physical therapy or chiropractic treatments, maybe even some injections, and they didn't really work. So now you're here to look at the next option, which is surgery. The most critical part of surgery decision making is to see if your symptoms match the MRI findings. If they do, then surgery should be a very good option for you. You will have the highest chance of successful surgery, one in which you will resolve all your symptoms and get back to normal full work function. So this is a representative MRI of a patient of mine that had a large left-sided L4-5 disc herniation. So in order to understand what that means, first let's talk about anatomy. In the lumbar spine, there are 5 lumbar vertebrae. So L5, 4, 3, 2, 1. And the discs are these oval-shaped structures in between them. They're named by the bones above and below them. So this is the L1-2 disc, L2-3 disc, L3-4 disc, L4-5 disc, and L5-S1 disc. And they should end right here. Inside this canal, these strings are actually the nerves that go down to your legs and bowel and bladder. Here you can see a very large protrusion. That's a large disc herniation from L4-5, causing significant narrowing inside the canal. It's really pushing on the nerves that are trying to go right by here. This here is the axial view, which is basically a cut view at the level of the disc, but we're looking at it from the top now. Everything is reversed. This is the left side, and that's the right side. So this is a large disc herniation protruding mainly to the left side. You can see there's really no room for the nerves here. In fact, all the nerves have been squeezed into this little tiny space here. The goal of surgery is to remove enough bone off the lamina here to open up the space to have access to this disc herniation and remove it. Typically, when you have a disc herniation this large, there are other pieces right behind it that are waiting to come out as well. So after we remove this piece, we look inside the disc space with a microscope and clean that out as well. Make sure there's no loose pieces waiting to come out after the surgery is done. So in this case, there was a left L4-5 laminotomy done and a discectomy. So as you can see, this is the disc. And if there's a herniation, it pushes right back onto the nerves that are coming out of the canal. The way we do the procedure is by removing this part of the bone right here, a little bit from L4, a little bit from L5, to get access into the disc space. So as you can see, as if I work this way, right through the lamina, I'm at the disc space. So we expose the disc, take the disc out, and look inside and clean that out as well. So what are the risks of surgery? There is risk of bleeding and infection, just like any other surgery. The other risks are all related to working on and around the nerves. Those include weakness or paralysis, numbness, loss of bowel and bladder function, and that surgery may not resolve all your symptoms. The chances are low, but never zero. You will typically be discharged home within a few hours from surgery. As for postoperative instructions, I would like to keep the dressing on and dry for the next 2 days. Then you can remove it and take a full body shower. But I would like you to avoid taking a bath or soaking it in a pool. I want you to keep lifting less than 10 pounds. You may walk or go up and down the stairs as long as you're comfortable. I will see you back in the office at 2, 6, and 12 weeks from surgery, and we will get x-rays periodically to make sure that everything is not only in good position, but that the healing is coming along as expected. You may get some physical therapy or chiropractic treatments after surgery. It will depend on a number of factors that we will discuss. Most patients typically go back to light duty work at 6 weeks and heavier work at about 3 months.